For sure. So, infants who are infected with hepatitis B in the first year of their life have up to a 90% risk of developing chronic hepatitis B, and that's associated with liver disease and cancer. So, if you think about it, the hepatitis B vaccine, especially in the early stages of life, is really like an anti cancer vaccine. And the reason we give it in the newborn phase is because it really serves as a safety net. So let's say that the mother's hepatitis B test is a false negative, or let's say a household or a household contact or a caregiver ends up being, an unexpected exposure, or let's say that for whatever reason the infant has delayed follow up, then really that early dose is protection against unexpected exposure. We anticipated that the rates of the newborn dose of the hepatitis B vaccine would be on the decline, but we just weren't sure to what extent. And we observed that there was a decline of up to 10%, or actually, sorry, we observed that there was a decline of over 10% in the birth dose of the hepatitis B vaccine in the last 2 years in the United States. And this was even before the ACIP had changed their recommendations in December of 2025, and the CDC updated their guidelines in January of 2026. So we anticipate that the rates may decline even further ever since that updated guidance has been implemented. Yeah, there are likely contributions from all the areas that you mentioned, but in particular, I would say that the COVID coming out of the COVID-19 pandemic, really there was a concern about messaging around the COVID-19 vaccine. And then that conversation seemed to shift into childhood vaccinations in general. And since then, these discussions have been going on in the mainstream media. They've been going on podcasts and in social media. They're going on in our communities. And they're even getting up to the policy level as we're seeing now, but they were still in the conversations at that time. And so those conversations probably, at least we think, are the most likely to have influenced the shift that we're observing. So our findings are all from before any of the updates to the recommendations. So it's possible that the newborn hepatitis B vaccine rates are going to decline even further. So our biggest concern is that if the hepatitis B vaccination rates decline too much, then we may start to see a rise in the cases of hepatitis B in infants and children. And as I mentioned before, the there's a high risk of the hepatitis B progressing into the chronic infection for infants. And so those complications that we discussed earlier, like liver disease and cancer, are the things that we really worry about. And so chronic hepatitis B has been on the decline for years. But if we see that the rates of the hepatitis B vaccine keep going down, then we may see chronic hepatitis B rates start to plateau or even potentially rise. As pediatricians and healthcare providers, we want nothing more than to see hepatitis B eliminated, not just in the United States, but globally. But until that time, we do have to stay vigilant in counseling families on the importance of the hepatitis B vaccine, especially early protection. And it seems like many families are concerned about the safety of the vaccine. And I appreciate that parents and caregivers are concerned about the safety of their children. Fortunately, we have decades of evidence that the hepatitis B vaccine is very safe and it provides protection against a really long lifelong illness and a life threatening illness.